Hi, I'm Dr. Tiffany Lester, a board-certified integrative medicine doctor. I currently see patients via telemedicine in my private practice. I specialize in providing culturally affirming, compassionate care that takes into account you as a whole person, not just parts of you. My mission is to guide people to tap into their own intuition and become their own health expert, where doing the least often produces the most healthiest outcomes. If you want to work with me, the best place to sign up is via my website, drtiffanyLester.com. Otherwise, you can find me on Instagram at Dr. Tiffany Lester, where I rant about unpopular opinions in medicine and share tiny doses of health advice you can start incorporating today. My mother inspired me to begin my journey into medicine. She was diagnosed with MS, which is multiple sclerosis, when I was in middle school, and I naively wanted to save her from this debilitating condition. So I planned to become a neurologist, but life has a way of redirecting you. Fast forward to my fourth year of medical school, where I took an integrative medicine course to get a break from the ICU. And I fell in love with this approach to health. As they say, the rest is history. After finishing my internal medicine residency, I completed a 2-year integrative medicine fellowship with Dr. Andrew Weil, and simultaneously learned medical acupuncture and took advanced functional medicine courses through the Institute of Functional Medicine. When I see patients, I have all of these modalities as tools in my medicine bag because there is no one-size-fits-all treatment plan. The beauty of integrative medicine is that it combines the best of both worlds. There is a place and time for medications, procedures, and even surgery. The goal of integrative medicine, though, is to prevent these interventions from happening in the first place or delay as long as possible. I look forward to the day where we don't have to differentiate the two because we're all just practicing incredible medicine. I specialize in autoimmune conditions like Hashimoto's thyroiditis, the gut microbiome like IBS and SIBO, and hormonal imbalances like PCOS and infertility. So I'm often asked how my approach to patient care differs from conventional medicine practices. The biggest difference in how I'm able to practice medicine is time. When you have the opportunity to spend 60 to 90 minutes talking to someone about their health journey, you learn 2 things. 1, what motivates them and what holds them back from their healthiest self. And 2, that if you listen long enough, a person will often already know what it will take to get them better, but they don't know how to get there. And I am there to guide them back to health with my expertise as quickly as possible. Often the barrier in conventional medicine is lack of time that clinicians are able to spend with their patients due to the structure and insurance guidelines of our current healthcare system. I get most excited about addressing all the layers of disease with my patients. The key to fully unlocking chronic medical conditions lies in the intersection of how emotional trauma impacts the health of our physical bodies. You might shed a tear or two in our sessions, but tears are healing too. After practicing integrative medicine for the past 12 years and seeing thousands of patients over that time span, I came to a realization that less is more. As a data nerd, I love to dive into all the specialty testing and labs with patients and connect the dots. I love to see that aha moment in people's eyes when they realize where the root cause of their symptoms lie and that there's a roadmap back to being healthy. What I don't love when we completely outsource our health and depend on complicated supplement protocols to heal. I believe supplements have their place and are often a necessary part of a personalized health plan. However, they cannot replace the foundations of health that are crucial to lasting wellness. These foundations are getting adequate sleep, eating nutrient-dense whole foods, and having healthy relationships and contributing to your community are just as important. So I met a member of the Beekeeper's Naturals team at the IHS Integrative Health Symposium conferences in 2023, and we just hit it off. The timing was perfect as BKN was just forming their medical advisory board and seeking out experts. I had been a longtime user of the cough drops and was excited to learn about the full product line. The team member sent me home with a bag full of supplements to try out. Once I really dove into the details behind the company, the integrity behind the products, and saw for myself how efficacious they are, I was in. Thank you so much for watching. I'm Dr. Tiffany Lester, a board-certified integrative medicine doctor and a member of the medical advisory board for Beekeeper's Natural.